Hello, everyone. I'm Daniel Heipel. I'm the president of Fostering Media Connections, and we publish the Imprint and Fostering Families Today, two publications that cover child welfare, juvenile justice very closely. I'm very happy to be with you all at the end of January 2021, a new year after one that was very difficult and trying on a number of levels for the nation as a whole, for the globe, as well as for our child welfare system. So I'm very happy that you've joined us, and I'm going to describe the format of the event so you know what's coming, and then introduce our guests and let their faces appear, and then get into the conversation. So we're gonna start with 15 to 20 minutes of opening remarks from our panelists, followed by another 15 to 20 minutes of discussion. Oh, can't hear me. Can you hear me now, Barry? So I hope people can hear me. I can hear. Okay, great. So wonderful. I'm being heard. So and then I'm going to do 15 to 20 minutes of discussion where I am leading the conversation, followed by some time for you all in the audience to chime in with questions. And throughout, please feel free to drop questions into the chat box so that I can go ahead and start thinking about what questions we're going to ask as we are moving forward. Thank you very much. So let's introduce our guests first. And first, I want to thank Binti for sponsoring this online conversation. I hate the term webinar, so we're going to focus on calling these online conversations from now on. But I want to thank Binti, which has done quite a bit in terms of providing software to child welfare agencies across the country, for sponsoring this conversation. And with that, I'm going to welcome Barrett-Johnson. He's the Director of Business Development at Binti. He's spent his career in child welfare as a practitioner and agent for change and innovation, most recently as Program Director at the City and County of San Francisco. He began his partnership with Binti early on, working with the Binti team to develop and implement their first module in San Francisco. I met Barry years ago when we were doing a project at UC Berkeley, and he was running a center at UC Berkeley where we produced a massive open online course. So I've known him for years. I also want to introduce Tony Lodge. He's the Vice President of Sun Scholars, has numerous degrees, including a master's in organizational leadership from Gordon Ford College of Business, and is currently a consultant in Washington, D.C. He aged out of the foster care system in Kentucky. I met Tony for the first time, hey Tony, at a briefing in Washington, D.C. in November of 2018. And I've thought about him ever since, and we're really happy to have him. We have David Hansell here. He was appointed Commissioner of New York City's Administration for Children's Services in February of 2017. He's committed his career to serving vulnerable communities and expanding opportunity. He has decades of experience in social services work across the public, private, and nonprofit sectors. Over the course of his career, he has served as a consultant to nonprofit government and philanthropic organizations on a diverse array of health and social services and policy advocacy issues. David, we're Commissioner Hansell, very happy to have you here. And finally, I'll introduce Tom Rawlings. He's the Director of Children and Family Services in Georgia. He asked me to, when I asked him for 2 lines about himself, he said to make some stuff up. I'm not going to make anything up. I will instead read a little bit from his bio, but he was appointed in February 2019 by Governor Brian Kemp to run the system in Georgia, where he supports the efforts of over 8,000 DFACS employees who protect Georgia's most vulnerable children and assist the state's struggling families. He previously served as interim director of the agency prior to joining DFACS. Tom served as Georgia's child advocate for the protection of children and helped lead efforts to improve Georgia's child protection system. So that's our panelist. If I could hear you clapping, I'm sure you would be, because that's a great group of people to have discuss what 2020 was and what we take away from it as we move forward into 2021 and beyond. And I've talked to all of these folks, and it is clear that there are some major changes afoot and some long-term impact. So with that, I'm going to let Barrett-Johnson take the stage and talk us through what he's learned from his vantage point and where he thinks things need to go. Barrett.
Thanks, Daniel. Appreciate you and the whole Foster Community Connections team. And I'm really excited to talk with have a conversation with the other panelists. A very brief 37-second sort of background on Binti and where we're kind of getting the context for this information. As Daniel said, I was Binti's first customer in San Francisco, but we've really expanded quickly since we launched in 2017. I joined about a year and a half ago. And we now are serving over 140 agencies across 22 states. We're launching in New York City as we speak, so it's great to have David on the line. We've been gathering a lot of information. We use a really intensive research project with youth and families and social workers as we build our modules. We're built by and for child welfare. So we have a pretty high touch with folks, and we've been talking to all those agencies and gathering some information about, I'm going to focus mostly on technology, but also on some practice issues that we heard about as we move forward, as we move through 2020 and what things are likely to keep as we move forward. So I always like to start here, though, with a big appreciation for all the work that everybody on this call has done. I think it's truly heroic to go through all of the multiple crises and reckonings that we've had this year. And we just need to constantly express the appreciation for all the work that everyone's done for youth and families as we've gone through this big year. So you can go to the next slide. I'm going to talk a little bit, and again, mostly about technology, but some practice and policy areas, about 5 key challenge areas. They're up on the slide, and I'll talk through them for the sake of time. I'm not going to review them on the top, but I'll talk about these areas. And then I know that other folks have other comments on various angles of these areas as well. So you can go on to the next slide, Daniel. So the first one is really not as much a technology focus, but obviously as we went through the racial reckoning, COVID, a lot of sort of big existential crisis as we moved on. Leadership became more important than ever, and I think relying on all the hard work that you've done and that leaders at all levels of the organizations that we work for have done on focusing on your mission. We've done a lot of work staying focused on our mission and values at Binti, and focusing on those practice models that you developed, because that's what you're going to fall back on as leaders to lead through the crisis. So that's certainly a theme that we've heard moving, from all of our agencies that we're working with moving forward. The second one, and I know the other panelists are going to talk more about this too, is especially the racial reckoning conversations that we've been having at a deeper level, and about the disparities within our systems and within other systems that are related to the child welfare systems, have really caused us, and I hope they've caused us, to have an existential look at what we're doing, what our purpose is as an agency, and really moving towards the community-based prevention care that I think we all want to be able to do. But we need to get more serious about that. And I'm encouraged by the conversations that are happening from the federal government and from some major stakeholders about moving towards that more community-based level of care and less towards our more legalistic interventionist strategies in child welfare. The second area I want to talk about, which is probably the biggest area that we learned in 2020 and more related to technology, is maintaining our operations during COVID. Binti's platform is fully mobile, So our customers definitely were excited, and some actually moved quicker to get on board with us as they had to move to a more remote, quickly to a remote system. But I think we've learned that we need more modern technology, and we need to empower our staff with the hardware and software that they need to do their jobs in the field. That's probably one of the biggest lessons that we've learned, and the one that we're going to keep. The other piece, the online portal piece of that middle bullet is we really need to concentrate on getting information and promoting getting information from our end users, the youth and families that we serve, and the resource families that provide such services. So we really focused on that this year, building out. We have a resource family portal. We're excited to be building out a youth portal for older youth and for families of origin as we move forward. And you can go on to the next slide. The third area that we heard a lot about is about connecting people. I think what COVID has taught us is there's, both in our personal lives and in our work lives and in social work, is that there really is no substitute for in-person contact. Certainly within families, there's no substitute for, just for healthy child development, for contact, human contact, physical contact. But we can use technology to have an additive impact. Why not have siblings talk to each other every night, or have the parent with a child temporarily in foster care be able to tuck their kids at night over Zoom? Doesn't take the place of it, but I think we really can transform how we use technology. Again, we also know that teaming, having a good, solid team that's chosen by the family to help them work through any issues that they need to work through is important. And I think we've learned you do have to have in person, but the days of having everybody come in all the time are kind of over now that we've got the modern technology that we're all using. So that's the connecting people area. And then the third area is communications. We heard immediately from our customers that they needed to get information once COVID hit. They needed to get information out to various groups of people in a simple way and quickly. So we needed to move fast and allow them to update the websites that we had developed for them. Make sure that the key information was out there. We developed a communication system that was much easier to put out critical information to different slices and groups of people, and that's not going to change. People have realized that they need to do a much better job using technology to communicate people in a way that really meets their needs, both youth, families, resource families. So you can go on to the next slide. And my final area is just this, the area calling it quick and adaptive change. So as COVID hit and as we realized the scope of it, policy, this is certainly an area where policy had to be adaptive, and federal policy, state policy, local policy had to be much more nimble and adjust to our new environment. And technology also has to do that. The days of having the system where you wait for a long time to get a simple update, like a form or an update in the requirements, are kind of over. We were working hard to make sure that we reflected all the new policy changes in our platform as soon as possible, so that agencies could take on top of it. And the court, I just wanted to make one final point, that the court also, I think different courts have taken different stances on this, but using technology to update their model of always in-person hearings has really been a key thing that we've been hearing from folks around the country. So I'm going to turn it back to you, I think, Daniel.
Yeah. And thanks for that. I mean, I think we're going to get into more of these issues. We're already getting some questions popping up, but I don't want to. I want to be able to get through everybody's discussion of what they've learned and what they're moving forward on. But this question of the courts is obviously a big one, and this question of connectivity and what that means for the child welfare workforce is huge. But with that, I want to introduce get Tony to talk a little bit. He's experienced the system himself, is really engaged in changing it, and has been interacting with a lot of young people on the ground throughout this very difficult year. So Tony, I'll let you take it away.
I'm with Sun Scholar. We're a nonprofit. Most of our staff that run Sun Scholar is successful aged out foster youth. And so this gives us kind of a real picture of what they're going through and, what they've been through. As Sun Scholar, we are committed to educational equity and graduation rates for successes of foster youth who, want to do more. We tackle social inequities, and I don't want to go through the entire mission statement, but some of the things that kind of have been interesting during the COVID is I've got I helped a lot of people when the university shut down because of COVID. There was a lot of students that had nowhere to go. Sun Scholars really stepped in and did all that we could. We try to provide guidance and resources to young people who have aged out. But one of the biggest problems, and that was brought to my attention, the technological accessibility. I know during my time in care, even when I was in college, going to the computer lab to apply for jobs, get my homework done, all the things that are kind of needed in today's structure or society. Once the university closed, most of those young people lost access to those kind of accessibility. I actually had it was actually brought to my attention last night, due to the, in the rural communities, the transfer of money into accounts. I had a buddy of mine say, we should use something like Cash App that can actually, get funding into young people's pockets quicker than actually having to go to the bank and along these lines. That was one of the biggest challenges that we sort of faced. Another thing I wanted to touch upon was, and just in my experience with the entire limelight of racial injustices that have happened recently in America, that has kind of, that has always been there in the foster care system. The challenges of African-American prospective foster parents that want to become parents. It's always been sort of a struggle in regards to that. And there's a large portion of African-American men that there's a large portion that fail right after aging out of the process. And that is due to a lack of network, a lack of guidance. That is something that I myself went through, not being able to have the resources to actually thrive after care. And those are some of the challenges right now that have really kind of, I've experienced, not having a lot of that. And, I think with applying racial equity lens, there needs to be better resources after the child ages out. And I always thought about going through care. I was able to gather mentors. Most young people don't go towards mentors, especially aging out, especially through traumatization. There's a lack of trust. And so I do think in sort of communities, and as not even on the federal level, but just rural small communities, there needs to be some sort of community committee that can kind of assure a kid is transitioning properly. I also believe that I know some of you guys have heard about the Chaffee program. I do think an expansion of the Chaffee program earlier in a kid's career, or before he ages out. There was something that Senator Cory Booker kind of proposed, like last year. It was, creating a small account for youth so they can have money later on once they graduate high school to be able to pay for college. I thought that was a cool thing, but I noticed, that could also be applied to Chaffee for kids in the system, letting that account build over time, to where they can, when they transition out, there's a pot of money waiting for them, and they have a mentor that can pretty much sort of guide them in what they need to spend that on. That is something that I very much struggled with, and we know Chaffee runs out very quickly. There's not a lot of the traditional time of you actually going all the way through graduation during your last year in your baccalaureate degree and still having Chaffee is very rare. So I do think creating some sort of expansion on that can really help kids. I think it could help them during COVID as well. That money put back could have helped, living arrangements, eviction notices, those type of things. I think we're all seeing. And some of the recommendations that I had, policy, the expansion of Chaffee, and an oversight committee for racial inequity. And I mean that through small communities, because that's kind of where it starts. Federally, we all know about the inequalities, but in small communities. So that's the stuff that I sort of experienced in foster care, and it's gotten tremendously better, but we're still very much long ways away from where we need to be. And technological accessibility as well. That's a big thing. Most youth in rural communities cannot afford the broadband, or they don't have broadband located in the area that they live in. So, a lot of the situations in the foster care system kind of rely on other policies to be successful. So I do think pushing on a technological expansion and maybe creating partnerships with universities can really lead us to, better outcomes during the COVID situation.
Great, Tony. Thank you very much. And I think, we're going to be hearing from Commissioner David Hansell next. Just one point you make about, there is we have a comment here from Abby Jordan talking about there's currently an expansion on Chaffee and ETV until 9/2021, and she's asking about, how do you make sure that continues past 2021? So that's something we can dive into in more detail. But it also brings up something that, the Administration for Children and Families brought up in a recent brief right before Commissioner Jerry Milner left, which was talking about, and Barrett brought this to my attention, this brief, but talking about, the flexibility needed to be able to give young people and families the supports they need, the material supports they need, to make sure that they can keep their households intact. So, but with that, I'm going to let I'm going to have Commissioner Hansell jump in and talk about the issues that, he's been seeing on the ground in New York City, which obviously was hit very hard by COVID in the early days. So, he really got a baptism by fire. So with that, I'll let you take over, Commissioner Hansell.
Well, thanks, Daniel, very much. Hi, everyone. Tony, great to hear your perspective and your recommendations. And yeah, actually, Daniel, your remarks were a good segue into much of what I wanted to talk about. So, New York City, absolutely, but I think the entire country has been through an incredibly difficult and painful time with COVID. It's hard to believe it's been just a year since the first case of COVID was diagnosed in the US. In some ways, it feels like yesterday. In some ways, it feels like it was a lifetime ago, but it's been tough. But for child welfare agencies and organizations, of course, our work didn't stop and couldn't stop. And the urgency of it didn't abate because of the other issues that we were dealing with. We had to continue to carry out our mission despite the pandemic, but we had to change everything, and we had to change much of it on a dime in response to new public health requirements. And so we learned a lot from that experience, and I think it's very important that we really take stock of what we've learned, and really the silver linings. That is where we have learned either about new ways of doing things that work better, or ways that we had been already evolving our systems that have really been demonstrated to make a great deal of sense because of the pressures and the lessons we've learned because of COVID. The three I want to touch on are expanding primary prevention services, again, technology, which has already been mentioned by Barry and by Tony, and then a kind of a different way of responding to child maltreatment. So let me start out talking about primary prevention, which is on the next slide. And when we talk about primary prevention, just to make sure we're all kind of on the same page, what we mean really is trying to get services to families further upstream, not waiting until there's a maltreatment report to the state hotline, not waiting until something bad has happened in a family, but really trying to assess and address families' needs at the earliest possible stage to help them build the capacity to raise children, to be strong families, and to achieve the kind of success in their families and communities that all of us want. So we have been for some years now in New York City building a structure and a foundation to do that. We have several what we call family enrichment centers. And these exist out, sometimes they're called family support centers, family resource centers, but basically they're hubs within communities. We've located them in 3 particular communities in New York City that have historically had high levels of child welfare involvement. And what makes them really unique is that they are co-created with families. We don't decide what the structure is. We go into the communities, we bring people in, we have what we call parent cafes, and we ask them, what is it you need in your community that you can't find? And we build a structure around that. Those family enrichment centers continue to function through COVID a little differently. And they were, I think, invaluable in providing hubs for families, both around concrete needs, but also just having social connection, which of course has been hugely important for all of us because of the isolation. And I think what we've seen is that kind of approach has been particularly important because of the devastation that families have been experiencing, the economic devastation, the social devastation, trauma, job loss, housing instability, actual homelessness, incredible health issues. All of those things have really affected a much broader number of families in our communities, and therefore the approach of trying to reach out with these kinds of services has been much more important. We also have what we call community partnership programs. Those are actually in 11 of our higher need communities around New York City. They connect families to other existing services in those communities. And then we also realized we really need to reach not just a small subset of families, we really needed to reach all families across New York City with information and support resources. So we launched a couple of new websites. One is called Coping Through COVID. It's resources for parents and caretakers. The other is called Teens Take on COVID, which is obviously, as it says, for teens who we know were experiencing a particular and a unique, I think, kind of isolation during this period, not going physically to school, not seeing classmates, not going to school practices or seeing coaches, things like that. So we tried to develop what we thought would be new creative resources that would be particularly helpful to families as they navigate the challenges. And this is certainly something that we're going to continue and I hope expand even as we begin to emerge from COVID. Second area is technology, and this has been touched on already. And again, this is something that we had been already really investing in at ACS, but we have really used, and actually I think the investments that we had made in the years prior to COVID really made it possible for us to pivot very quickly to different ways of doing business, to telework, and to working really much more in the community and not in our offices. Now, as has been said, video technology will never replace in-person interaction, but it can enhance service delivery. It can be, I think, a really important adjunct. And just like as we are here today, we probably wouldn't have 246 of us with us today if we were doing this in person as opposed to video. So there are a lot of reasons why it's been useful. It's been useful for families that are involved in the court system. They don't have to show up, sometimes spend a whole day, take a whole day off from work to sit and wait for their case to be called. It's been helpful for families receiving other kinds of services. We found it's been very useful for teens and adolescents. They often engage better virtually than in person. So we think that that video technology, telehealth, teleservices have proven to be a very important resource that we want to continue. But if we're going to do that, there are a couple of ground rules that I think are essential. One is we have to make sure everyone has access. Everyone has the hardware and the software to be able to participate in services virtually. And then we also need to have clear guidelines and expectations. And because we want to make sure that they're not just visits, but they are quality visits. And so putting in place the right kind of standards for telehealth and telesocial services, I think, is going to be extremely important as we go forward. We also have used them for staff as well, and that's enabled us really, our child protective workers, as they go into families' homes, into the community, to provide information to families on the spot rather than having to go back to their offices and pull up information and share it. And then the final area I wanted to talk about is thinking about how we respond to families differently. We know, I think all of us in child welfare know, that the reports, many of the reports that we receive that begin with an allegation of some kind of child maltreatment, when we look into them, actually what they really revolve around is poverty, isolation, other kinds of factors, social factors that families are experiencing. They're not really fundamentally about abuse or neglect of children. And so I think it's important for us to think about responding in those terms. And we in New York, and I know many other states do this as well, we have an alternative to the traditional investigation that we do when we receive a maltreatment report. In New York City, we call that CARES. And what we do is, if we do an initial investigation, a report comes in, we don't really see any initial safety factors, we move to an alternative approach in which we work with families to identify their needs, identify their challenges, identify what kind of services would make a difference, and then try to connect the families with those services they need. So it's an approach that's family-centered, that's solution-focused, and that's support-driven. Now, again, this is something we had been doing in New York prior to COVID, but largely driven by COVID, we've decided to make a really dramatic expansion. So as of this month, we are expanding this across all 5 boroughs in New York City. So families in every part of the city would have the opportunity. And by the end of this year, 2021, we are going to double the program in size so that many more families will have the opportunity to receive services from ACS through this family support approach. And we're very excited about the impact that that will have. So those are just a few of the ideas that we have really been thinking about, that we think really have been affirmed by what we've seen during COVID, and that we intend to focus on as we emerge from COVID and think about what the future of child welfare in New York City should be, and we hope will be. Thanks, Daniel.
Thank you, David. Just a quick question on the CARES approach. So I mean, are you seeing reductions of numbers entering the system when they're put into that track? And secondarily, you know, to what degree do you think that that's been a boon in connecting people to services as the COVID recession, as they call it, sets in? I mean, how much does that prompt this expansion?
Yeah, well, certainly, as we divert more cases into the family support track, the CARES track, that means there are fewer families that are going down the investigative track. Typically, when we investigate reports that come in of maltreatment, 2/3 of the time, we decide there's no basis for that report. We don't find any evidence to support that, and we do what's called, we call it unfounding the case, and that's the end of it. But that doesn't mean those families don't need services. So we think if we could start from the beginning by focusing on service needs rather than investigations, we could probably respond to those needs much faster. And yes, absolutely, I think what we're seeing is because the entire focus of our interaction with those families in the CARES approach is around service engagement, we do think it does a better job of identifying service needs, connecting to services more quickly, and I hope that will continue as we emerge from COVID.
Okay, thanks, David. We're getting a ton of questions already. So Tom, I'll let you share the slides that you put together yourself. Tom is a slide master, you know, aside from being the head of a child welfare agency. So I'll let him take us through his slides, and then I really want to get to everybody's question because, you know, they're piling up fast. So with that,
thanks, Daniel. If you can go to that one slide, I think what I presume that, yeah, here we go. A lot of what I wanted to talk about has already been covered, especially by Barrett and David. I think one of the things we've learned is that in the 2020s, we're still acting like a 1970s agency here in Georgia. So we, of course, handle not only child protection, child welfare, but also eligibility for SNAP and Medicaid and whatnot. And we were still doing that sort of, let's fill out this paperwork. Let's have you come down to our office. You know, we're going to come out to your house and and check on you. And so I think what we've learned is a couple of different things. Number one is that we really can do all this in a couple of different ways that both better support families, because we are doing face-to-face when we need to, but we are also doing it virtually. And so, for example, in our court hearings, families or parents who may have not have been able to travel to the court hearing can participate virtually. We may have a child who is in a placement a good ways from the court. We can better ensure that that child is participating in the court proceeding virtually. We, of course, with our eligibility especially, are doing much more in terms of virtual lobbies. I think our efficiency in getting benefits to individuals is better. And I think for our staff, the ability to work remotely, it's been contrary, of course, to our governmental mindset of, I need to see you in the office to make sure you're doing your job. But especially for our younger generation that is much more comfortable with doing things virtually, with doing things electronically, we are really freeing up our workforce to spend less time commuting and more time actually doing their work. I think the same thing applies, of course, for even our older youth in care. We don't, I think if we can have a FaceTime call with them, for an 18, 19-year-old, why are we doing a lot of this in-person stuff? I think part of this, really, I think what we've also seen last year, not only the COVID issues, but also certainly the unrest, the police brutality issues, is that people are angry. And I think they frankly should be. We all know that joke about I'm with the government, I'm here to help you, right? We all heard that. Well, I think truly in child protection and child welfare for the last 40 years, or certainly longer, we have always felt, but I'm the good part of the government. I really am here to help you. But I think the truth is that a lot of the families that we seek to serve don't see us that way. And so we have heard a lot of, I would say, constructive criticism over the last many months from those who have seen our social work infrastructure as perhaps intrusive in the same way that sometimes people are afraid of coercive police powers, coercive government, et cetera. And so I think what it reminds us is that if we are actually investigating a case of child maltreatment, then we do need to take that seriously. But we really need to remember that we are dealing with families who have the right to family integrity, the right to liberty, who are not required to do what we ask them to do just because we are the government. We, I think, have the opportunity, as David Hansell mentioned, to really, are we actually, even when we get a case in, we get a call in, it turns out to be perhaps a case of need, not a case of child maltreatment, not a case of imminent danger of a child. Are we going in there and saying, you need to do this? Or are we actually connecting that family through our family support system or alternative response cares, whatever you want to call it? Are we actually saying, look, you do what you want to do, but here is an actual local agency that can help you if you want their help? And doing it in a way that actually we are actually serving individuals, and we are not coming in as a powerful entity that is coercing you into doing things. And so I think probably one of the biggest lessons I've learned from this past year, in addition to how to manage in a COVID environment, is to say, are we as an agency really here to serve? Or are we here to show our authority as a government agency? And I think if we can make that shift, then I think what we'll have more of is the ideal of child welfare and family services that I've always had in my mind, which is this little circle to the right. Normally you have in the middle of that circle a stick figure of a child. I put Bernie there because everybody else puts Bernie on everything these days. But the idea, of course, is that if we're truly respectful of the right to family integrity, the best interests of the child, the rights of the child, then what we will do is we will do everything in our power to let parents be parents, to assist extended family in serving their own kin, to connecting these families with actual local community agencies, especially nonprofits, the faith community, so that it's not this government coercion. And then, of course, we as the state, our job should be primarily to support these more friendly structures, these more service-oriented structures, and only enter into the situation when we really need to do so to protect a child who is in imminent danger of harm. I think the bottom line is on this is that we have to change our system from one in which we are actually seeking to fix family dysfunction, as opposed to making parents who we have deemed to have done something wrong jump through various hoops to prove that they can be parents again. That's kind of my brief summary, and I'm looking forward to the questions, Daniel.
Okay, so thanks, Tom, and I want to just jump to Tony real quick because and you know, Tony, so Tom's talking about coercion, right? The coercive power of the government, you know, and part of that is investigations and all those types of things. Young people in the system, you know, deal with, you know, are interacting with social workers prior to the pandemic, oftentimes in person. I mean, you know, having experienced the system itself, what kind of is there a benefit to having the option of virtual interaction with social workers for the young people in the system?
Because I deal with mostly aged out, but during my time in foster care, you know, it really does depend on the kid itself. And I guess with the social worker, that type of relationship. And correct me if I'm wrong, you're asking me if virtual sessions.
I'm wondering, you know, to what degree, look, we've got this perspective of the child welfare system that Tom raised, which is, you know, that it's a quasi, you know, it's got kind of sort of quasi police function. And in that case, you know, the concern is using coercive power. I'm just wondering, you know, from the practitioner side for Tom or David, to what degree that, you know, this, you know, being able to do things without the knock on the door, if that creates an opportunity to kind of take the temperature down interactions with agencies. And for you, Tony, just, you know, is there a benefit for young people, you know, to be able to have this mix and match of ways to communicate with their social workers, which isn't always come down to my office or I'll meet you at the McDonald's or whatever it is?
Yeah. Okay. Yeah. I think, and I do say that it depends on the kid. I know, you know, a lot of the foster youth I grew up with, anger management. Every time someone say, let's go to the social worker's office, what does that usually mean? It already creates a hostile environment for them. They're already going in like they're going to war. And it doesn't help with the parents either. So I do think, I support what Tom is saying, not having this over dark presence on a family home. But I do think if that's the case, I do think that there's more accountability for foster parents to, be able to communicate more effectively with the child. Because you can't have your cake, you can't have your dinner and have your cake too. You gotta, if you don't want that over presence of, what it feels like when the social workers are called or you're having discussions with them, I do believe that if that's the case, there needs to be more accountability for the foster parents to be able to, the whole point is to not really call the social worker less, but you want the social worker to be there during the good times more the less than the bad times. So I do think the accountability measures for the foster parents need to be increased if that's the case. And again, I say it depends on the kid. because not all kids that, you know, when the social workers and the entire system comes into play, do they feel like they're going to war? But more or less, that is kind of the case that we're dealt with, is when social workers have to step in. It's never, you know, give me an update on the kid and how is this kid doing and how is everything going. It's usually more of a law enforcement presence that it really shouldn't be the case. So I do support Tom and what he's bringing to the limelight.
Thanks, Tony. And so then to David or Tom, whoever wants to take this, but just, you know, in terms of that question of temperature, I mean, do you see any lasting change because of the use of technology in all kinds of interactions with families? Does that kind of technological barrier help in your minds at all, or is that just conjecture?
Let me hit it real quick. Then I know David's a whole lot better on this than I am, but I think it cuts both ways. I think that my deputy director for child welfare, for example, has brought up a specific point, and I think she makes a good point, that if you can make a contact virtually, it's a little less intimidating than having a CPS worker knock on your door. And at the same time, I think we also have to be aware that we don't want to discriminate essentially against those who don't have technology. I am also worried about that. You know, are we going to now require everyone to have a smartphone? And I think so it kind of does cut both ways.
Yeah, I think that's right. I mean, there's no question that having having a stranger come into your home is an intrusion. It would be an intrusion to any of us. And so, yeah, I think to the extent that we can use technology to minimize that kind of impact on families, that's a very positive thing. But I guess I'd also say, well, I'm a believer in technology, and I think it can be a very important tool. It's a tool. And in the end, what counts is not which tool we're using, but what message we're communicating. And I think if the outreach, whether it's in person or on video or by phone, however you do it, if the outreach is basically about trying to identify what families need and help them get it, that's a very different message than the one that, you know, too often child welfare systems deliver.
We got a question from Cassie Statuto-Bevan, who's over at UPenn and was one of the architects of the Adoption and Safe Families Act when she was on the Hill. And she was asking about technology and child protection, right? So, you know, there were a lot of movement around this question years ago, but it seems, you know, I don't know what the latest on that is in terms of using technology in that context. Barry, you know, do you want to take that question on her question about, you know, how do you use technology? And I don't have the question in front of me because it's back now in this flood, but to something to the degree of, you know, how do you use, let me see, I got it right here. How can technology promote child safety? So, Barry, have you guys been working on that at all at Binti, or? You're muted, my friend.
You'd think I'd be better than that by now. You know, we're doing a lot of research with youth, families, workers. I mean, I think technology has a big role in safety, in getting the information that's critical for the people going out on their smartphone, connecting them to a team via technology that can process through and think critically about safety issues. I mean, you know, we all know that someone out there by themselves without adequate information is not going to have a lot of support for making those critical safety decisions. And it needs to be a collective decision that has stakeholder involvement in it. So, for example, in San Francisco, we began using red teams on the very front line to really talk about when we were addressing safety issues, bring a team in, and we brought them in virtually and brought community partners and prevention partners in virtually to really give us context on what services could be provided preventatively. And so technology can do that. At Binti, we need to prompt those sort of points. We know that we need to prompt the points of critical thinking and have our technology prompt those, and allow the technology to bring more team decision making in. So that's a lot of.
That's an interesting read on it. I mean, because a lot of times you think about technology as just kind of synthesizing information for the individual decision maker on the scene, but it sounds like what you're talking about is also being able to bring in multiple voices in real time as you're making decisions about child safety, potentially a removal or something like that.
Right, and being able to gather as much information as quickly as possible, and not just for those safety decisions, but throughout the life of a family's involvement with the agency, they should be able to provide more information themselves. The youth should be able to provide information themselves, so that we can really get their perspective and involve them in the services. I mean, we can't just impose our sort of services on folks. And I think everybody here has been really clear about that. We have to really engage folks and in that process. And technology can, it doesn't take the place of really great engagement and work by our social workers and our community partners. But it can prompt that and prompt thinking, getting more information and more involvement from the youth and the families in the work that we do. So, building out portals for families to even share information, photos, of youth, critical information, cultural information about what youth, with the resource parent, about what youth need in terms of meeting their cultural needs is one way that technology can do that throughout the cycle of the case.
Great. I've got a question from Anita Taylor. What efforts have been made to educate the caseworkers on what is really family dysfunction, taking into account race, religion, and ethnicity? And I this is obviously a big issue. Is some cultural competency, which child welfare systems, by virtue of the rampant disproportionality that is true of every system, there's a big question about that. I mean, have in the wake of what we saw in May and the murder of George Floyd and the subsequent racial unrest, I mean, how have your systems, David and Tom, been changing around this question?
Yeah, that's very important. I'm glad that was right. We've been talking a lot about the impact of COVID last year, but I think our work has been just as much affected, if not more, by the impact of the racial justice movement, the Black Lives Matter movement. And there too, we know that there is a long and very disturbing history of racial disproportionality in the child welfare system across the country. And it's certainly true in New York City and continues to be true in New York City. And so we had, again, even before COVID, even before the racial justice movement and the demonstrations of last year, had been focusing on addressing racial inequity in all the work that we do, and really moving to becoming an anti-racist organization. And the events of last year have only forced us to focus more on that. So we, a couple of years ago, actually developed and began implementing an equity action plan in which we looked at every stage of a child or a family's involvement with the child welfare system and looked at the disproportionality that gets introduced into the system at each of those stages. And then basically developed theories of change as to what we could do, changing policies, changing practices, or changing our culture within the organization that would address that and would reduce those inequities. We've done it through a number of programmatic change. And by the way, this is all available on our website. Anyone wants to take a look at it. A lot of it's programmatic and policy, but a lot of it has to do with internal agency culture. So we have now been, for a couple of years, now been doing implicit bias training for all of our staff, because we do think it's important that everyone, child protective specialists, but everyone who's making these very complex, very important decisions about children and families is aware of the potential introduction of bias into those decisions and therefore can guard against that. So I agree that is an absolute top priority for us, and I think is a top priority for all child welfare agencies.
Tom, did you have a thought?
Yeah, I would just simply say that we're talking a lot, and there's a lot here in the chat about about discretion, about whether or not you give folks discretion. I would suggest that it's not only racial disparities, it's power disparities. I'd also suggest that almost every single young, especially, but social worker who comes into our office who wants to work with us, if we give them the right training, if we help them understand what their role is, and then we actually free them up to do what they feel is best to help that family with whom they are working directly, then I think that actually will diminish some of the biases that get built in, not necessarily even at the street level where the interaction occurs, but really at the administrative level where people say, I haven't met this family, but it looks like they have this problem. So what we're trying to do in partially in response to these issues is actually shift more discretion to our frontline workers, and of course, monitor their use of that discretion, but really encourage them to say, you've gone to school, you're here to help families, we want you to help families, and quit worrying about such things as liabilities. We want you to take smart risks to help this family recover from whatever dysfunction they have without being a bureaucrat and saying, oh my God, I don't know what to do here, so I'm going to yank this child into foster care, or I'm going to put this family under some kind of intensive case plan.
Every one of these online conversations, I come away with something new. And as I hear you all talking, and I'm looking at the chat and understanding that we're coming already to the end of our hour together. What's interesting to me is this question of, well, as we try to address racial disproportionality, and we're talking about discretion falling on one person and the value potentially of multiple minds getting into this decision making, and multiple minds that have been trained on what their biases may or may not be, so they're elevated in that decision making. There is probably a meld of technology foisted upon us by this COVID crisis and the reckoning that has been iterative in the child welfare field about the racism within the system and the disproportionality that exists there, and kind of the bellwether moment we're at where you have to do something. And it seems to me there's probably an opportunity to meld both as we move into this new year and new hope, really. So with that, I want to just ask each of you, and we've got all these questions. We're happy, you've got everybody's email addresses, so you can send them directly, and we can, I can ask all of you guys to take a look at them and respond to any ones you want. We could maybe send something out because there's too many to answer right now, unfortunately. But maybe you could just close us each one of you, just saying, what is the big thing that you're going to do differently now after having endured this year, whether Tony fielding calls from foster youth, whether Barry trying to get technological systems in place, or Tom and David, leading two very large, very different agencies through very difficult and different times. So who wants to take that first?
I think do you want to go first, Tom, or?
No, go ahead, Tony.
Okay, yeah. I just know, just by hearing people, I think, even though I think we were outgunned during this pandemic, and I think I personally was. What I'm taking away from this, I think, is creating more partnerships in being able to assist foster youth during these harsh times. There wasn't a lot of scrambling was happening, but not a lot of solutions were being met. And I do think, kind of for my organization and just for myself, is creating more partnerships that can actually give aged out foster youth who are experiencing harsh times the ability to actually, get some of these opportunities and solutions that can really, decrease that anxiety and stress upon their lives. So I do think, with that being said, even with the racial lenses of, the racial injustices that were happening, you had a lot of people of color within the foster youth system who don't have many connections versus, their white counterparts. And I think being able to have more partnerships in other nonprofit sectors and the resources to aid them will greatly increase their, their optimism throughout these hard times. And I think this is a lesson to everyone. So that's sort of what I'm taking from this as a nonprofit perspective.
Great, thank you, Tony.
Two sentences. Everybody in the chat is bringing up really good points about collaboration, about networking, about forming really these local cross thought ideas, whether it's across mental health, across social work, across NGOs. I completely agree with that. I do believe that the closer, the more we can devolve discretion and authority and the ability to help families to the local level and to the local team, that the less bias, the less abuse of power, the better outcomes we will see. And that really is my takeaway from 2020 and what I hope taken in 2021.
Thank you.
Guess you've given us kind of an impossible task, Daniel. I think I'm not quite sure.
Yeah,
It's hard to boil a complex problem, but I guess if I were going to, sort of focus on one theme, it would be engagement. I think we need to, and COVID has demonstrated, we need to really redouble our engagement with families around assessing and responding to their own needs, and engagement with communities around understanding the impact that our systems have on them. In ways in which we can alter that.
Barry.
And I would say a similar thing to David, and from a technological perspective, is really doubling down on engagement and using technology to engage more stakeholders, more prevention partners, more families and youth in the process. Really focusing, our research and doubling down on the research on the end recipients of the services that we offer. And engage using technology to integrate them into the process as much as possible. We were on that road, but I think we're really learning that we need to double down on that moving forward.
Excellent. Well, I appreciate you all taking some time today to talk about what was 2020 and what will be 2021. We all have a lot of hard work to do, clearly. And so I appreciate everybody's engagement in different parts of the country and in different sectors of the field. So with that, I will just say thank you and look forward to the next time we get to get all back together again. So thank you. And thank you to everybody who attended, and thanks for all your comments and questions. I wish we had more time to get to them all. Thank you.